So the Rolla Immediate Care Clinic as well as the Waynesville Immediate Care Clinic will be open throughout the week from 8 to 8 and on weekends from 8 to 6.
The only days of the year that we are closed are Thanksgiving and Christmas. So we have a full slate of providers to be here every day of the year except those 2 days to meet everybody's needs.
No appointments are needed. We serve patients on a walk-in basis. Since opening our Waynesville location in 2017, we've been serving patients from near and far, many of which come from our Rolla area. To better serve our community and offer more convenient quality care, we decided opening a clinic in this location would be very beneficial.
We serve as that place where if your doctor's not in the office, it's after hours or the weekends or they're on vacation, that we serve as that extension of their office. It's not just Phelps Health providers, it's all providers in the area, even in the St. Louis area, even Springfield, people who are coming to Rolla from out of town to visit family, or we have a lot of people who come to the Rolla, Fort Leonard Wood area for 3 months at a time as a contractor, and they have an issue and they don't have a primary care.
So we see patients with a pretty wide variety of illnesses. We see patients with urinary tract infections, we see patients with orthopedic issues, sprains, fractures and things like that, lacerations, just kind of some of your basic upper respiratory illnesses like sinus infections, ear infections.
We also see things like insect stings and bites. We see animal bites. We see orthopedic injuries. We have quite a few of people that comes in with sprains, strains, and fractures. We can take care of that, and we can coordinate care then with the orthopedic specialists if they need that level of care. We can connect the dots to the specialists they need to see. We also have full x-ray capabilities here, and when I say full x-ray capabilities with conventional x-rays, so when we do those, they go onto what we call the PACS system. So that x-ray can be seen in the emergency department, can be seen in a physician's office who has PACS capabilities. That's really important. If somebody comes in here with a fracture that needs orthopedic attention today, then they can go to the ER. They don't have to have their x-ray repeated. They can see what we did here and then move on. So that works really well. So we're trying to make this where you get seamless care, whatever your presenting problem is.
Yes, the same services will be offered. We can also assess work-related injuries, help patients with return to work assessments. We also offer vaccines, school, evaluations, sports physicals, and we have x-ray services as well.
Other things that we're able to do in the clinic as far as testing, we can do strep swabs, influenza swabs, we can test for RSV, we will have the capabilities to test for COVID-19 and tests of that nature. We do basic urine tests, urinalysis, pregnancy tests and things of that nature.
The immediate care is a great option for patients if they cannot get into their primary care provider, their office is closed, or your medical need does not require a trip to the emergency room.
So I think that's kind of one of the big benefits of the immediate care. We're actually able to kind of fill that gap and provide a connection for some patients who may not know or don't have a primary care provider. We can actually schedule their appointments from here, get their establishment of care appointment set up, and make sure that they have the long-term and chronic care that they need.
If somebody walks in with a potential life threat here, we have the capability, all of our people are advanced cardiac life support and pediatric advanced cardiac life support certified. So we can get you, stabilized till the ambulance gets here to get you to the hospital. But if you have any of those symptoms, chest pain, shortness of breath, severe shortness of breath, or issues that you think are potentially threatening, like stroke-like symptoms, you need to call 911 and get directly to the emergency department because time is of the essence.
Yes, the immediate care accepts a wide variety of insurances, including Medicare, Medicaid, and TRICARE.
If somebody doesn't have insurance, we have a patient financial services person that will work with them. So if you need something, don't avoid us because you don't have insurance. That we have care managers that will work with you in helping you get the services that you need.
To learn more about the immediate care in Rolla, please call us or visit phelpshealth.org.